Okay, so we're recording. Anna, hello, I'm Laura, and I'm really, really grateful to you for giving of your time freely to come to talk to us today. I'm sorry that my camera's off. We've got a bit of a funny connection today, but at least we can see you. So I wonder if you could just begin by introducing yourself, a little bit about your current role.
Okay, of course, yes. Hello, I'm Anna. I'm an advanced nurse practitioner in Sheffield, and I'm also the non-medical prescribing development lead for South Yorkshire Workforce and Development Hub, and that's a role that came from a piece of research that I did, which I'll explain more during this recording now. But yes, so I'm a primary care nurse by background. I've worked in primary care most of my nursing career, community nursing, practice nursing, and now as an advanced nurse practitioner.
Thank you. So when we were chatting before, you were sort of saying that a lot of your current work is about putting the kind of findings of your work into practice. So I think that's going to sort of be quite a big part of what we talk about. But just to sort of set the scene, could you tell us a little bit about how you came up with the topic in the first place, that your kind of research question, if you like?
Of course, yeah. So, as you go through your nurse training and as you do kind of any advanced training, then there's always the kind of the focus on evidence-based practice, isn't there? As we kind of go through as nurses, what does evidence-based practice look like? But as we go through kind of our careers and we go through work, we find that there's things that there aren't answers to, or things that we think should happen, but it's not actually happening. And there's that kind of disconnect between those two things. And research is fantastic at being able to connect those two things together. So as part of my Masters in Advancing Practice, I did my prescribing qualification. And there's loads and loads of support that you have as you're kind of doing your prescribing, loads of mentoring, loads of kind of input from university. And then you get to the end of your training and there is nothing. And I was like, well, this isn't right. So I kind of spoke to the people that kind of led in the kind of CCG, and they were like, oh, no, it's up to an individual to kind of continue to develop. And I was like, it didn't feel right. It didn't sit right. So that's why I decided to kind of look for my dissertation on that, was to kind of look at, well, what does best practice look like? Because you can't just say this isn't right. You have to have the evidence to kind of back you up. And the exciting thing about research is that the evidence could have turned around and said one thing, or it could have turned around and said something else, and you don't know. So it's like mining for gold. It's like, what is out there? What have other people looked at, and what are the, are there answers? And if there are answers, how can we change practice through these answers? So it came as a kind of a gap in the service when I looked at kind of what wasn't available and said, well, is there a gold standard, and what should that look like?
Okay, so really, you in your locality, you kind of perceived, or in your sort of practice, you perceived this gap, but you were curious about whether that was something that was everybody's experience, and if it wasn't, what were people doing to support newly qualified NMPs that you could perhaps put into practice?
Yes, definitely. Yes,
okay,
that was a good summary.
It's kind of a nice sort of clearly boundaried sort of question, isn't it?
Yes.
So I'm guessing it. Well, no, I don't need to guess. I can ask you because you're here. So how did you kind of go about searching for the literature then, to answer that question? Kind of where did you look?
Yeah, so it's really interesting, isn't it? So there's lots of different acronyms, aren't there, to kind of create your question in the first place. So you always start off with a massive idea, don't you, or kind of massive thought of, I wonder what this could look like. And then you have to kind of set the kind of the criteria, don't you, like a PICO or a PO. So it's kind of, what are the population I'm looking for? What's the kind of outcomes? What's the evidence there? So it's kind of really honing down that question, and using my academic supervisor was a really useful tool for that. So you have to start off really broad. So you never start off really specific, because then you lose things, don't you? You start off really broad. What are the potential questions here? What are the potential ways that I can search? And you put all of those things into your search engines, and you come down and down and down and down and down. So you start off with hundreds of papers, as I'm sure you've all found as you've been doing essays and things. You start off with different searches, non-medical prescribers, NMPs, independent prescribers. You use lots of different terms. You kind of get hundreds of papers, and then you start the process of excluding. Actually, they've been written too far, too long ago. I'm not as interested in what people have got to say from 2006, because actually the kind of the profession has changed a lot since then, you know, and for me, I was specifically looking within primary care, so I excluded secondary care and kept to primary care. I was looking at practice nurses and advanced nurse practitioners. So if they kind of talked about health visitors, I excluded those because they're not covered by our trust. So it was things like that. So it's being very clear and continuing to have that conversation with your academic supervisor and being clear about what's the focus that I'm looking for. Otherwise, it just becomes such a scattergun that you can never focus the question down.
Yeah, that absolutely makes sense. And I suppose it sounds like you didn't necessarily know about the questions that you were going to ask to help you refine it until you were like, oh, you'd look at a paper and you think, oh, that's very interesting, but actually it's not related. So you had to be kind of quite clearly boundaried with that. Yeah, that makes sense. And kind of when did you know that you kind of found the question, if that's not too obscure a question to ask? Like, when did you feel like you'd refined it sufficiently and that what you had identified in the literature was going to address that particular concern?
I think it's when sometimes you find gold. Sometimes you start off with a question and you can't find anything out there because what I was doing was a kind of a systematic review rather than a primary piece of research. So sometimes the research hasn't been done yet. So you can have a question that's brilliant, but if the research has not been done, then and you're not in a position to do primary research, then you have to park that. Whereas for this, because non-medical prescribing has become such a large part of kind of nursing and allied health professional work, there had been quite a lot of work that had been done on it. And it was as I found some really key research pieces, I was like, brilliant, this is going to work. And actually there's some really key research here that'll be really, really important. And it was kind of through reading those papers and talking again to my academic supervisor, was kind of pulling those down, you know, again, from being really broad to kind of pulling it to more specific and more focused, and what exactly was I going to look at.
Yeah, that sounds like quite a sort of complex cognitive process. So without going sort of massively deeply into sort of the analysis of what you found, could you summarize what happened next and how it's led you to the role that you're doing now?
Yeah, so again, you kind of came up with themes from the literature, and again, my academic supervisor, who they're always spot on, so always use your supervisors to kind of bounce off. But she suggested using a CPD model that two professors, Kim Manley and Carrie Jackson, had written about kind of development, and it was all about kind of how to change how kind of education, continuing professional development, postgraduate education, how it can't just sit with one person. There's multiple levels that it needs to sit at. So I used the research to put into this kind of model of development, and kind of wrote some recommendations about what best practice should look like. And in some ways that was the easy bit. And then I had to start the really difficult process of telling people that, or kind of telling people's the wrong word, building relationship with the people in my trust to say, you know, I'm a clinician on the ground. This is where I feel that the gaps have been. I've looked at the research and this is the kind of examples of best practice. How can we implement this? And that took a process of about 2 years of kind of having those conversations, you know. And the advantage of research is when people go, oh, no, that's not the case. You go, well, actually, the research says this. And people can't argue with that, which was a really interesting perspective from kind of coming from a position of going, oh, I know things need to change, you know, throughout my career, I know things need to change and I've got this good idea, to actually, it wasn't just a good idea, it was a good idea that was backed up by really robust evidence and some really robust kind of recommendations. So it kind of went through, so it was kind of building a relationship, it was kind of raising my head above a parapet and getting shot down a lot of times, and having a steep learning curve in what it means to kind of present at strategic meetings and all this kind of thing. But now I'm in a position where I run regular monthly events for non-medical prescribers. which are really well attended and really well evaluated. I sit on the medicines optimization team as they kind of discuss and develop the formulary for our area. And I'm the only kind of nurse that sits on there, so that's a really positive thing. And I've kind of been working at creating a framework and a policy for non-medical prescribers to see change happen. And it's been a real privilege to be able to do that. And I never, ever would have been able to do that without having done this piece of research. And it's opened so many doors as a result of doing this research. So, research is amazing and it's not dry. And it's really, it changes, it can have a massive impact on practice.
That's absolutely, I mean, your enthusiasm for it comes across so clearly in what you say, but it's such a clear line almost from the excuse me, from the question to the process to actually having a change in practice. Sorry, it's not COVID, I promise. Not that it would matter because we're
no, online.
Yeah, no, I love the way that you kind of you sort of enthuse about the kind of process of research. I wanted to ask kind of one more question really, because it sounds like it was a little bit not necessarily accidental, but non-intentional as a kind of outcome of where you know on this kind of advanced nurse practitioner route, and then you did prescribing, and now suddenly you're in this like quite significant strategic role.
Yeah.
So I wondered about for you whether your kind of recognition that research is valuable was a sort of light bulb moment or a slow burn. Did it happen when you were an undergraduate? Did it happen when you did your master's? Was it just when you did the systematic review?
Yeah, it was definitely a slow burn. There's a lot more talk about research now and about being a kind of clinical academic and being, a kind of research nurse. And I don't think those, I started my training in 1997, so I'm ancient. And I don't think there was those kind of conversations that were happening. And I do wonder whether if those conversations were happening when I was kind of back in my early days, whether I would have been more interested in research at the time, or whether actually for me, it was seeing the impact of research on practice that was really important. I'm not sure, or also because one of the pillars of advanced practice is research. So, it's really important to kind of to be competent and to kind of to be able to use that to kind of influence practice. But it's definitely been a slow burn. And I think for me, I'm not a natural researcher by personality. So there are definitely personalities that love that kind of analytical side of things. For me, it's the fact that it's impacted change. That's what's excited me about research, is the ability and the language that you get from doing research that give you the skills to change, patient outcomes and to change the profession for the kind of future. So yeah, definitely a slow burn, but definitely for me, it's the impact that research has to change, like I say, patient care, patient outcomes, and actually the workforce development. That
sounds like a sort of theme that quite a few of these interviews have highlighted, which feels to me a little bit like the nurse in the research is that that desire for it to kind of directly inform and improve the experience of patients or of colleagues or of practice. And it's been really interesting for me, I think, to hear specifically from nurses about what they love about research, because that's, I would say almost everybody has kind of described that in some form or other, that it is about making things better in real life and in real terms. So thank you very much. If you're able to share any links as they arise to either policies that you're developing or blogs that you've written or anything, I'll pop them in the links for people to read a little bit more about, because I think it's fascinating. And certainly as an independent prescriber myself, I think I really recognise that sort of lurching into the world. And it's something that I'm very, very curious about. So I'm going to stop the recording, but before I do, I just really want to repeat my thanks to you, Anna, for giving your time today, and what a brilliant showcase of a piece of work directly turning into practice. Thank you so much.
Thank you, Laura.